Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. In today's video, we are going to put a spotlight on erectile disorder, or more popularly described as erectile dysfunction. Erectile disorder or dysfunction is part of a larger category of conditions called disorders of excitement. And you may recall in a couple videos back, I went through the sexual response curve and we talked about desire, we talked about excitement, orgasm, and resolution. These are the four phases. We're putting a spotlight in the second phase. So let's take a quick look. And I say we're going to put a spotlight on erectile disorder because the other disorder we talked about in the previous video. So go back to that video and there's some good content there. So let me pull up this slideshow. All right, so here we are. As I mentioned, we're talking about disorders of excitement. And as a reminder, the excitement phase of the sexual response cycle is marked by changes in heart rate, muscle tension, blood pressure, respirations, all of these physiological responses that indicate sympathetic arousal. Now, anatomically, the male, you can tell that there's excitement as evidenced by an erection, so an erection of the penis. And for women, it is a swelling of the clitoris and the labia, as well as vaginal lubrication. Now, the two dysfunctions that are in the disorders of excitement phase are the female sexual interest and arousal disorder. The DSM-5 puts these two concepts together into one disorder. That's why we talked about it in the previous video. But male erectile disorder or erectile dysfunction, as it's popularly referred to, is the other. So that's the one, since we didn't cover it yet, we're going to talk about now. So what is male erectile disorder? This has to be a chronic condition for at least 6 months or longer, where a person struggles to either obtain or maintain an erection, or they struggle to maintain the rigidity that they previously had during sex. Now, this condition occurs in as much as 10% of the general male population, and we're not sure if that's even the right number because there might be some underreporting. Now, having the disorder is different than having periodic problems. So if we were to track males across the lifespan, about 50% of adult males will have some erectile difficulty at least some of the time. And it could be due to a whole host of factors. It could be specific to alcohol use. It could be more generalized, but about 50% of males at one point or another will report having trouble. And the erectile disorder comes from several aspects: biological, psychological, and sociocultural processes, which a lot of them are the same for desire as excitement. So there is some redundancy here. So let's talk about biological causes. So we know that estrogen, progesterone, and testosterone are linked to sex. So having low T is a common cause for erectile disorder. Having hypoactive sexual desire can be a cause for erectile disorder, but it could also be a blood flow issue. And if it is a blood flow issue, the way it works is that there are two blood vessels on both sides of the penis that inflate during sex. If they're not inflating properly, it's going to interfere with your erections. But we can test this. We have measuring devices. We have something called nocturnal penile tumescence, which is, I don't know if you can see on the right, there are these rings that you put around the penis while going to sleep, and it measures the number of erections you have while you're asleep. And the premise is we do have erections while we're asleep. We may not notice it, we may not remember it, but it happens. And this will be able to track the strength and frequency of erections, and it could indicate potentially a physical basis for an erectile disorder. So, psychological factors, we see that depression and anxiety can significantly impact one's performance in the bedroom. So, when it relates to depression, 90% of people with severe depression are going to have some level of erectile dysfunction. 90%. So depression can really impact one's ability to perform. Same thing with anxiety. So a person might have something called performance anxiety. So let's say you struggled to maintain an erection in the past, you might have some anxiety that, hey, am I going to have this problem again? So you have anxiety around the act of sex, and that creates problems with getting an erection, or exacerbates it, because anxiety, we need to be in a somewhat calm state for us to be able to obtain an erection. So that performance anxiety is the worrying about, am I going to be able to perform properly? So when that happens, there is also a cognitive piece that happens, something called a spectator role. So instead of enjoying the experience of the sex, the person becomes more caught up in their own mind, and it's as if they're evaluating their performance instead of just being in the moment. And this performance anxiety and spectator role becomes a vicious cycle. And because of the anxiety, it actually creates more problems in the bedroom, more of a risk of erectile failure. And this vicious cycle gets worse and worse and worse. So these are not the only causes for, or psychological causes for, erectile disorder, but they are pretty prominent, right? So anxiety and depression are pretty in the front. Now, from a sociocultural factor, the same sociocultural factors linked to hypoactive sexual desire can be linked to erectile disorder, things like cultural differences, spiritual belief sets, things like the experience of an environmental trauma, a sexual trauma. All of these things could impact sexual desire. But two in particular are very prominent as it relates to desire. If you're having problems at work, or if you're having problems in your relationship, so I say marital distress, but it doesn't have to be a marital situation, these are particularly relevant for erectile disorder. Absolutely relevant. So, but I want to see if we can talk a little bit about some treatments, and then we'll do a quick wrap up. So there are many different treatments one can apply to address an erectile disorder. First is the tease technique. In sex therapy, the belief is that if there is a problem in a bedroom, it is a shared responsibility for the partnership. So if one's partner is having a hard time obtaining or maintaining erections, we might say, hey, have you considered trying the tease technique, which are gentle caresses and strokes until the person develops that desire, they develop an erection, and then we stop caressing our partner until the erection subsides. And we do this over and over and over, and it's kind of retraining the brain that, hey, I can get an erection. And maybe this was anxiety. And the tease technique long-term is going to result in spontaneous erections. And why it's so powerful is because the anxiety or the psychological pressures of sexual intercourse, if you know that this is just the technique unrelated to engaging in sex, the pressure's off, right? So you can do the tease technique and strengthen the frequency of erections, and that's going to restore sexual functioning. We also know that on the market, there's something called a vacuum erection device, and that's the picture on the right where a person puts their penis in the center of a cylinder, and they have a hand pump, and they pump it, and it creates a vacuum seal and more pressure on the penis, and that is eventually going to, with sufficient pressure, going to initiate an erection. So I put this in a different order because as a psychologist, I am recommending the tease technique the best, right? But there are other ways to handle it, right? So the non-psychological intervention of a vacuum erection device, the gel suppositories and injections, these are pretty invasive, not addressing the psychological cause. Now, if it's a vascular issue, right? So we're not dealing with psychological problems. So if it's a biological issue, things like these vacuum erection devices, gel suppositories, erections, and there are pharmacological treatments like Viagra, Cialis, and things like that. They make a lot of sense, right? So if I'm a psychologist, I have to figure out, well, is this due to some psychological issue? Is this due to some biological factor? So I might recommend you go to a urologist and do an ultrasound to determine the blood flow. And if that blood flow is fine, then we know that it is more likely psychological. If there's some kind of problem, then treatments 2, 3, and 4 come into the foreground. So that is the concept of an erectile disorder. I hope you found it useful. I hope you found the following things you should have acquired from this video. One is what happens during the excitement phase. 2, what is the criteria to be diagnosed with an erectile disorder? 3, some of the causes for an erectile disorder, and 4, some of the treatments. And then the myth, right, of that you're always going to perform, I dispelled as well. 50% of males have at one point or another some problem with performance in the bedroom. And that is our video. If you found it useful, if you learned something new, give me a big thumbs up, a like button, subscribe, click the notifications tab. That is how YouTube understands you value this content. And how I would like is if you could put a comment or a question down below. That's how I can engage a little more. And I would love, love, love to turn this into a learning community. So any questions, any reactions you have to this video, please put them below. I read and respond to all of them. Until next time, take care, everybody.